Good morning, everyone. Thank you for joining me today. My name is Siaw, and my ID is 9808311354640001. Welcome to my presentation on communication and counseling skills for nurses using the LEARN framework. And today I'll be discussing how this framework can enhance patient-centered care and enhance communication and building rapport. Let's go into it. Okay, so for introduction, psychoeducation counseling is a vital component of nursing practice, particularly in enhancing patient care and promoting health literacy by Mike Lacy et al. 2024. As healthcare professionals, nurses play a crucial role in educating patients about their health conditions, treatment options, and self-managing strategies. This process not only empowers patients but also fosters a collaborative relationship between patient and healthcare providers, which is essential for effective care delivery. So, the LEARN, the LEARN framework, stands for L for listen, E explain, A acknowledge, R recommended, and N negotiate. This structured approach guides nurses in providing patient-centered care by improving communication and building strong patient relationships. By active listening to patients, nurses can identify their concerns and needs, which allows for tailored explanation and enhanced understanding. Acknowledging patients' feelings and experiences further builds trust, creating a safe environment for open dialogue. Recommendation based on informed discussions enables patients to make educated decisions regarding their health, while negotiation ensures that their preferences and values are respected throughout the care process. Reflecting on my experience with psychoeducation counseling, I have observed that how a LEARN framework influences the quality of patient interaction and outcome. So for under reflective, the experience using the LEARN framework, the first will be listen. So let me share a reflective experience from a labor and delivery ward where I applied the LEARN framework. So during my time working in labor room, I encountered many first-time mothers who expressed significantly anxiety and also uncertainty about their postnatal care. So one particular case that stands out that was on Miss Y, who was overwhelmed with questions and concerns after her delivery. She shared her worries about how to manage the basic tasks such as passing urine, passing flatters, and also expressed a fear regarding her episiotomy wound. So Miss Y felt a lot of very lost and also anxious, unsure how to take care of herself and her newborn. Listening to her concern was crucial. It allowed me to understand her emotional states and a specific area where she felt insecure. So for under explain, recognizing the importance of providing clear and comprehensive information, I took the opportunity to explain the postnatal care process to Miss Y. I addressed her the concern about her episiotomy wound, emphasizing the importance of the proper hygiene and the care to prevent infection, as well as the significance of balanced maternity diet and encourage fluid intake to support her recovery. I use diagrams to visualize the illustrate how to care for the wound, that what is the sign to watch for the infection that might be indicate complication too. For under acknowledge, I made sure to acknowledge Miss Y feelings of overwhelm and anxiety, which are common among the new mother adjusting to the demands of care of a newborn. I validated her concern by expressing that it is entirely normal for new mothers to feel this way, especially when faced with the responsibility of caring of a newborn. So, acknowledging her feelings helped her to build trust and rapport, allowing her to feel more comfortable sharing her thoughts and asking questions. This supportive environment encouraged Miss Y to share her thoughts and also ask questions, facilitating a more effective communication process. So under recommend, to further support Miss Y, I recommended her that she can ask me any question that she had, no matter how small that seemed. This open invitation to inquire emphasized that her concerns were important, that I was there to help her to navigate the new phase of her life by encouraging her to voice her question to and uncertainties. I aim to empower her and reinforce the idea that seeking clarification is a vital part of her care. Additionally, I informed her about the daily visit from the midwives, who would conduct postnatal checks-up to ensure her safety and well-being. This reassurance was crucial as it helped to alleviate her feelings of isolation and anxiety, making her to feel more supported in her experiences, knowing that she had a dedicated team available to monitor her health and provide guidance contributed to her sense of security and confidence in managing her postnatal care. Okay, so finally, I collaborated with my colleagues to develop a tailored postnatal care for Miss Y, which was essential in addressing her on encouraging. Finally, I collaborated with my colleague to develop a tailored postnatal care for Miss Y, which was essential in addressing her ongoing concern and ensuring her felt supported throughout the recovery. This plan included regular checkups and educational sessions to address her ongoing concern and provide her ongoing concerns and provide her with knowledge she needed to care for herself and for her baby confidently. We discussed the importance of follow-up visits and also encouraged to voice any additional concern. Reflecting on this experience, I realized the profound impact that effective psychoeducation can help on patient care. By utilizing the LEARN framework, I was able to provide Miss Y with the support and information she needed to alleviate her anxiety and empower her as a new mother. This experience reinforced my belief in the importance of psychoeducation in nursing practice, particularly in the labor and delivery setting, where new mothers often face significant emotion and physical challenges. So, reflective on the effectiveness of LEARN framework. So, empowering the LEARN framework in facilitating patient understanding during postnatal journey has proven effective, particularly in the case of Miss Y. Active listening. By actively listening to Miss Y concerns about her postnatal care, including her anxiety about managing her episiotomy wound, and caring for her newborn, I was able to identify her specific needs. This essential step was crucial in establishing trust and creating an environment where she felt comfortable sharing her concerns. Active listening involves more than just listening words. It requires a journey engagement with Miss Y's emotional states and willingness to understand her perspective. This approach allows the nurses to gather vital information that informs subsequent care decisions. So, I given clear information regarding postnatal, emphasizing the importance of hygiene, dietary needs, and recognizing signs of potential complications. Utilizing diagrams help clarify complex information, making it easier for Miss Y to understand. The psychological changes was experiencing, such as uterine involution and continuous contraction due to hormonal changes from breastfeeding. This comprehensive education is essential. So furthermore, acknowledging Miss Y feelings of overwhelm and anxiety validated her experience as a first-time mother. This step is vital for empowering patients as it helps them to feel understood and supported, which significantly reduce their anxiety and also improving their engagement in their care. This acknowledgement also encourages patients to engage more activity in their care as they feel concerns that taken seriously. So, recommended Miss Y actively participate in the care by asking questions, seeking clarifications whenever necessary. This approach not only empowered her but also encouraged to take the ownership of her health and the newborn's care. Furthermore, involving Miss Y in her care education reinforced the information provided to ensure the continuous support from the midwives. So, collaborating with the healthcare team to develop a personalized postnatal care for Miss Y allowed her to feel involved in her care. This negotiation process ensured that her preference and concerns was integrated into her care plan, enhancing her confidence in managing her recovery and the new responsibilities as a new mother. Involving the healthcare team in education and care provided, and the care plan provided continuous support demonstrating that patient-centered care is collaborative effort. The application of Learn framework in Miss Y's postnatal journey emphasizes effectiveness in enhancing patient understanding and empowerment and engaging by improving structures and comprehensive education. I was able to alleviate her anxiety and equip her with the knowledge and necessary to care for herself and her newborn. This experience highlights that it is crucial and importance of postnatal education as supported by WHO in improving and the health outcome for mothers and also infants. So next, how does integrating the Learn framework in patient care contribute in enhancing communication, building rapport, and also promoting patient-centered care? Integrating the Learn framework into patient care significantly enhances communication, builds rapport, and promotes patient-centered care. This structured approach facilitates a deeper understanding between healthcare providers, especially nurses and patients, ultimately leading to better health outcome and patient satisfaction. So the first step, listen, is under enhancing communication, emphasizes the importance of active engaging with patients by attentively listen their concern. Healthcare provider can gather essential information about the patient's condition, preference, and anxieties. This active listening fosters an environment where patients feel valued and understood, encouraging them to share more openly. This explained component focus on providing clear and concise and relevant information tailored to the patient's level of understanding. By breaking down complex the medical jargons into the simpler terms and using visual aids when necessary. Healthcare provider can ensure that patients grasp essential concepts about the health and treatment option. Acknowledge involve recognizing and validating patients' feeling and experiences. This step is crucial for building rapport and trust, and it demonstrates empathy and also understanding. When patients feel that their emotions are acknowledged, they are more likely to engage in the conversation, like ask questions and express concern. So this open communication is vital for effective communication, patient education, and care. So in the recommended phase, healthcare providers offer tailored advice and also resources that align with the patient's needs and preference. This personalized approach not only enhances the relevance for the information provided, but also encounter patients to take an active role of their care by recommending specific action or resources. Providers facilitate a collaborative relationship that fosters ongoing communication. So, finally, the negotiate component emphasizes the importance of a shared decision by collaborating with patients to develop care plans that reflect their goals and values healthcare. The healthcare providers promote a sense of ownership and also responsibility in the patient's healthcare journey. This negotiation process enhances the communication by ensuring that the patient feel heard and also involved in their care decision. So, for building rapport, explaining health information clearly and understandingly is vital for building rapport. When providers take the time to break down complex medical jargons into the layman's term, patients feel more informed and also empowered. Patients more likely to trust nurses who take time to ensure they understand their illness, which strengthens the rapport. Acknowledging a patient's concern can significantly reduce the anxiety and also foster a supportive environment. Study has shown when healthcare providers express understanding and empathy, it enhances the therapeutic relationship and also encourages patients to engage more actively in their care. So when nurses recommend the tailored strategies and also resources, it demonstrates the commitment to the patient's well-being. And also this personalized approach not only emphasizes patients, but also emphasizes the idea that the preference and the values are respected. So by involving patients in discussion about their care option, foster a collaborative atmosphere and also strengthens rapport and also encourage the shared decision making. So, finally, under the negotiate steps, it involves collaborating with patients to develop the care plan that reflects their needs and also preference. This partnership approach is crucial for building rapport, and it emphasizes mutual respect and also shared responsibility in the healthcare journey. So next will be promoting the patient-centered care. The listen component encourages nurses to active listening, engaging with the patients. This active listening is crucial for understanding the unique context for each patient's situation. By prioritizing patient's voice, the learned framework aligns with the principles of patient-centered care, which emphasize respect for individuals' preference and needs. Explain on the potential outcome enables patients to make informed decisions about their care and available treatment options. This transparency fosters a collaborative environment where patients feel valued and also respected, reinforcing the patient-centered approach that prioritizes patient autonomy in their healthcare journey. So, furthermore, the recommend phase of Learn framework is crucial in promoting patient-centered care by providing tailored advice and also resources that align with the specific needs and preference of each patient. Nurses recognize the importance of addressing patients' emotional well-being in addition to their physical needs. Train staff to provide compensated care, validating feelings and create a supportive environment. So lastly, the negotiate component and emphasize patient-centered care involve a collaborative approach where healthcare providers and also patients work together to make informed decisions about the treatment option and also care plan. This negotiation process not only enhances patients' engagement, but also ensures that the care is truly centered about the patient's individual needs, which is a hallmark of the patient-centered care. So, conclusion. In conclusion, the integration of Learn framework in nursing practice plays a vital role in enhancing patient-centered care, particularly in the context of psychoeducation counseling. By actively listening to patients, the healthcare providers can identify the unique concern and needs, fostering an environment of trust and also open communication. The frameworks emphasize on clear explanation and empowers patients with the knowledge necessary to understand the condition and also the treatment options, thereby promoting informed decision making. Acknowledging patients' feelings and also experiences is essential for building rapport and reducing anxiety, which is especially important of vulnerable populations such as first-time mothers. By recommending patients' care strategies and also involving patients in the negotiation of their care plan, healthcare providers can ensure that treatments align with the patient's values and also preference. This collaborative approach not only enhances patient engagement but also reinforces the sense of ownership over their health journey. Ultimately, the Learn framework not only improves communication and rapport between the healthcare providers and patients, but also contributes to a better healthcare by prioritizing the individual needs of patients. As highlighted by the WHO, the effective postnatal education and support are crucial in reducing maternal and also infant morbidity and also mortality rates. By implementing the Learn framework, nurses can create a supportive healthcare environment that empowers patients, enhance their understanding and also foster a holistic approach on care, ultimately leading to improved health outcome for mothers and their newborns. So here are some of the key references that supported the contents of this presentation, particularly those related psychoeducation and the Learn framework. So this additional reference provides a further high insight into the communication strategies and also patient-centered care practice discussed today. Okay, so thank you for your attention. I'm now happy to discuss any aspect of the presentation that you'd like to discuss further. Thank you very much for listening.